John was just talking about Lucy Haslam just then, and I'll remind you that there's going to be an Australian story on Lucy's story and Dan's story on Monday at 8 p.m. So that's something to keep in mind if you want to continue. Oh, if you want to sort of follow that up, it should be a really good program. Now, sorry? It's Australian story. It's about the Haslam family who've been campaigning for medical cannabis. All right, well, our next speaker is Dr. Sandra Bailey from the Greens. She's going to tell us, or give us the Greens perspective. As John was mentioning, the Greens federal leader, Senator Richard Di Natale, has been taking quite a good and interesting stand on this with the regulator of medical cannabis bill, or is it the regulator of medicinal cannabis bill? Medicinal, is it? All right. Regulator of medicinal cannabis bill. And would you please welcome Dr. Sandra Bailey? Well, can I just say one thing before... look, we're still trying to get people to make contributions. And I think we've got the contribution box there. So if you're leaving and you still haven't, and you want to make a contribution to the cost of the leaving, which is reasonably considerable, yes, just putting in that donation box on the way out. Okay.
Thanks, John, and thanks everybody. And I'll be quite brief because much has already been said today. Just wanted to confirm that the Greens have been in favour of legalising medicinal cannabis for many years and have tried in various avenues, different states. And we also acknowledge that it has been used for thousands of years, as Dr. Catalara said, throughout the world, and that the people do know what works. What we tried to do in the Greens under the leadership of Richard Di Natale was in November put a bill before Parliament to regulate the use of medicinal cannabis. That received bipartisan support. It went to a committee, as was outlined, and the committee voted in favour of it. So it looked like there was good cross-party political support for doing this after so long. The idea was that because the TGA is quite a complex organisation that wasn't really geared for dealing with a herbal type product like cannabis, that an independent regulator be set up to basically be a rule maker for all the states in terms of the growing of the product, the manufacture of the product, the distribution, the prescription of the product, the research around the product, all of those things. So it would be a kind of a tidy, linked together process in each state. So that was the regulator of medicinal cannabis bill that was to be voted on, but we've been preempted just today by the government itself, which has said they're offering something different, just authorisation of growing the crop. So the outcome from there will depend on what happens when the state premiers get together with the Prime Minister before the end of the year to work out the logistics of what can happen in the different states, and we'll have to wait and see that. The conditions behind the bill were really the main four conditions as outlined in the Victorian Law Reform Commission. So it was particularly the effects of chemo on people with cancer, particularly the nausea, the vomiting, and at times the pain of people with cancer, also for people with HIV, for the children with epilepsy, for the spasms and the pain in multiple sclerosis, and certain nerve pain conditions which could be authorised by a couple of specialists. So they were the initial patients that were going to benefit from it, but with the ongoing research, which is monumental worldwide, other conditions would potentially be included along the way. It's said that cannabis is one of the major foci of research in the world now, and that we're on the cusp of a revolution in the recognition of its use. It's the re-recognition, isn't it, really? Because these things have been known for a long time. but breaking through the conservative barriers that have been that our kind of society has put up. There are issues with doctors. Doctors are by nature conservative in most cases. And for this to be something that can ultimately be prescribed by doctors, it needs to come through with credibility. It needs to be recognised that this is kind of well understood. If doctors in general are going to cooperate with the process, and I guess that's what we'd hope for in the long run, wouldn't we? That you wouldn't have to go to a small number of specific providers, but that doctors in general would be open to it. So if it's done in a very respectable, well-documented way, there's a greater chance of winning over the profession to which I belong. That's probably as much as I need to say. I think you probably know the Greens are behind this, and we're pleased with the announcement today, but we would have thought it could have been a much more comprehensive one, so we'll just have to wait and see what permissions the states are going to be granted beyond the capacity to grow it, because that's only the first stage. Thanks, everyone.